population are women. And so sadly, in the course of working in this space, I have witnessed the horrific encounters that women have in the healthcare system when they fall pregnant, especially in the public healthcare system. I'm also the founder of the Women at Risk International Foundation. And this is a non-profit organization that tackles rape, sexual violence, and child abuse across all the communities in our country. So again, I stand witness to many of these women and girls. When we talk about improving healthcare across Africa, in Nigeria, we appreciate that it makes sense. It makes sense because it's a moral imperative, but then it also makes sense because we're told that it's good business. A recent McKinsey report actually said that if we are able to close this health gap and address this equitable quality of healthcare, we can potentially boost our economy by $1 trillion by 2040. And so it's actually good business to invest in women's healthcare. When we talk about healthcare, we're talking about a multi-sector industry. And when we talk about the challenges of healthcare, we need to appreciate that that also is multifaceted. And so it calls for many players, and it calls for many of us in this room to serve a role. So I want us to now explore, how do we reimagine women's health? How do we improve on the existing healthcare structure that we have? And I want us to walk through the journey with Atinuke. So Atinuke is 14 years old. She was herself a survivor of rape by her biological father. She's one of 4 children. Her mother is a child bride, so her mother married her father when she was 12. Atinuke stopped going to school when she was 10 because they couldn't afford to send her to school any longer. And so Atinuke is at home being violently abused by her father, her mother being complicit for multiple reasons. We live in an environment where sadly women don't have agency in many homes and can't speak out against these issues. So we're not condemning Atinuke's mother, we're acknowledging that this is her reality. And so Atinuke is in need of healthcare. And so how do we assist her? Let's reimagine what we already have. Let's imagine the WARIF Rape Crisis Center, a facility that's in Yaba that serves survivors of these sort of acts of violence. Atinuke would come into our Rape Crisis Center, and she would immediately be met by a warm, caring staff of professional individuals. Atinuke would have all of her concerns addressed physically, cuts and bruises, testing, HIV concerns, morning after pill, is Atinuke pregnant? Then she would have counselors to address her emotional concerns and to start her journey of healing. And then beyond that, Atinuke is probably in need of some sort of social welfare. Because remember, we said Atinuke does not come from a home of means. So she might need shelter. She probably might need legal aid if she decides, I would like to take this further. It's not right what my father's doing. She might need a vocational skill, because remember, Atinuke wasn't able to finish school, and she has to earn. So these are all the services that are provided for at the Rape Crisis Center that I work at. And all our services are offered 6 days a week, including all public holidays. And we opened in 2016 December, and these services have not stopped until today. Sadly, the youngest that we have had to offer these services to is only 7 months of age. I repeat, 7 months of age. The oldest is 71 years of age, and we've seen all ages, all different economic classes, all different educational statures throughout the course of my working at the Rape Crisis Center. But beyond the Rape Crisis Center, we tend to take these types of services also into our communities. And the reason why this is relevant is because 40%, or rather 46%, of Nigerians still reside in rural communities. Not in Lagos, not in Port Harcourt, not in Abuja. And when we look at the informal sector, 60% of it is still very much run by women. And so if we're dealing with a problem across Nigeria of this magnitude, we can't ignore the community-based women. And this is where our programs, like our Gatekeepers program, which is a program that we help traditional birth attendants deal with these issues of rape, or other stakeholders, like our religious leaders, are also our police force in changing their narrative and their mindset. We've worked proudly with partners like ACT Foundation, who's in the room, and other international organizations in pressing forward and pushing this agenda across these many communities. Beyond that, how else can we help Atinuke? We can help Atinuke by exploring partnerships that actually matter. We can start to look at this through the lens of governmental leadership. Where are we with this public-private sector partnership and collaborations that we all advocate for? We can talk about other civil society organizations and the work that they do. And we can talk about international support by working with international organizations, which is also something we do. And then we can also help Atinuke by working with agencies that are already existing, like our Domestic and Sexual Violence Agency in Lagos State, that's working in this problem. And we can explore other areas and working with other agencies even outside of our state. So collaborations allow us to do so much more with so much less. And it helps break down that duplication that tends to happen when we all work in silos. And then it allows us to open doors to more funding, which is an important aspect of the work we do. The third way we can help Atinuke is to look at the community-based interventions that are real catalysts. We should stop thinking of it just through the lens of working in urban centers, working with other like-minded people. But we need to explore why and how we can help vulnerable women. How do we take these programs, like our Women's Empowerment Program, into these rural communities? How do we partner with some of you in the room to be able to achieve that? Because if 60% of our women are in the informal sector, then we can't leave them behind. So how do we empower them? And then how do they play catch up in this growing, terrifying world of digital technology and artificial intelligence? We also have to look at communities that are also embedded in the patriarchy of our country. Communities where traditional practices are alive and well, where women are complicit because they're institutionalized. When you go into certain communities where there's female genital mutilation being practiced, there are no men around. It's a purely private women's affair. It's a grandmother holding a grandchild. It's a traditional birth attendant who's female holding the blade. And it's other children lining up. Where are the men? But at the end of the day, these practices are condoned because the edict of the traditional leader, who is a man, have declared that this is what should transpire in this country, what should transpire in this community. And so we need men as allies. We need different beneficiary groups as points of contact so that we can help Atinuke by changing her community's mindset. So perhaps her mother wouldn't have gotten married at 10 and she wouldn't be a child survivor at age 14. Another game changer is policy and advocacy. We know that. We can talk till we're blue in the face, but if we don't have policies to change the dynamic, if we don't have laws to enforce the change, and if we don't have law enforcement officers that are trained to be able to implement, then we're not going anywhere very fast. And so this is another aspect that I think, if we look into, we can certainly help Atinuke. And last but not least, Amici will be happy to hear, is using the story of power telling. Using the story of power telling. And yes, Amici, that's Adobe, Amici's sister in the picture. And the power of storytelling, we cannot underestimate. We heard the panel today. We had examples that were given. We know, first and foremost, that majority of us hate to read long texts, but we enjoy a clip. We like our TikTok. We like our little reels that tell us something that's informative. We love what Apricot Doctor does. because it's humorous. And so this is why it is so important that creatives, those in the room, those that have left the room, need to partner with institutions and agencies and organizations like ours to change that narrative. So, what does this all say? It says that from a narrative to a movement. So what are we trying to say? We're just trying to say very simply that can we use the creative arts as a tool for social change? I know Amechi's coming up after me, and the branding conversation will probably do a deep dive into this. But I think this actually, if you ask me, is where our call to action should lie. We need to stop thinking of the top-down reforms, as I said. We need to start thinking, how do we start building these revolutions? We need to start thinking, who are my partners? Because I need everyone in the room to help me. It's not a niche problem. It's not a woman's problem. It's a human problem. Yes, I stand here and I give you statistics of 1 in 4 girls. But in countries like Nigeria, it's 1 in 8 boys before the age of 18. So it's a gender problem. And we have to remember that the policies that we need to implement are beyond economic. We always focus on the funding and the financial aspects, but there's the educational aspect, there's the social aspect. It has to be multi-sectorial in our approach in changing this narrative. And so in the end, when we reimagine women's health together, we don't just save lives, we change entire communities, and we protect generations yet unborn. Thank you very much. To taking questions now from anyone in the room. Thank you.
Questions?
Or comments?
Anyone?
Oh, wonderful.
Right.
I'm glad it was so well received.
Okay. Yes.
Okay, thank you so much for that insightful presentation. And in the midst of it, we could see the problems which a number of people are not just unaware of, but they're just indifferent about it. Now, you talked about that we should do more of storytelling, and you raised a very instructive statistics about the number of women that are in the rural communities. But how do we reach them, particularly with a language barrier, with a lot of this conversation happening in the city, and we have to reach the people who are unaware, they're not educated, their mind is full of certain perspective or, what do you call it now, superstition. That is our tradition, this is our part. So how do we take this gospel, quote and unquote, to the rural community and speak their language, that it can have confidence that, oh, there is a people that care about what we're going through? That's just the question.
Thank you for that question. I think you probably answered the question in your summation. It is a long game because we are dealing with social drivers that are entrenched in our way of life. And these social drivers are intergenerational. Our cultural practices, don't get me wrong, we have beautiful culture. We have beautiful heritage. I mean, I think everyone in the room will attest to even just our music, our food, our fashion. But we can't ignore the detrimental impact of our culture and some of our practices when it comes to women, especially women that sadly are marginalized, if you will. And I say that because we're also caught up in the facade of a good woman versus a bad woman. And so the good woman is that married woman in her marital home. And the woman that's unmarried or the young girl that's, not in school is viewed through a different lens. When we go into communities, with that sustainable attitude of knowing this is a long game. We take our time by working with the stakeholders in the communities to earn the trust of the community. I can't walk into your home and bark orders at your family and expect them to listen. But if I go through you and you speak on my behalf, then clearly I have the buy-in of your family. So you must work with the stakeholders and you must respect them. And respecting stakeholders, a big part of it is learning their language. I mean, get interpreters, get translators, use books, but you must respect them and you must meet them at their point of need. And by meeting them at their point of need, if it means you sit down, you break cola with them, you understand their needs through that lens, and then you identify the stakeholders in those communities, and then you share the issues with them. And that starts to see transformational change in the trust, and then eventually in the impact that you leave in these communities. Thank you.